Okay, I'm live now, I think. I did that before. I just started going, and the last time it was kept saying the whole way through I got halfway through and it kept saying, your live video is starting. I'm like, oh crap. So today is Bacilinum, which is the tubercular nosode. And it's made from the sputum or the mucus of a person that has tuberculosis. So someone who has tuberculosis, that whatever sputum they came up with, they took it, put it in maceration. So they took it and they put that into, something for it to sit in for a while, like alcohol, most likely. But so then from there, they took it and they succussed it, which is pounded on your hand or a book or something, that they pounded it, and that gives you a 1C. And they take it out, drop out, put it on sugar tablets. That way that stores that 1C. Then you take one tablet out, put it into another 99 drops of alcohol, and you pound it 100 times again, and that gives you a 2C. Now you take that out and put it on sugar tablets so that you have the 2C preserved. You can keep it and use it, just like, I don't have my kits here, but and then you have the sugar tablets. That's a 2C. Keep doing that. You can go up to 30, whatever. So that's how Bacilinum nosode is made. Now there's other ones that they actually mention here, and that's Bacilinum testium, which is tuberculosis of the testicle. I didn't know you could get that there. What was the other one? There's another one, so let's get into it. Bacilinum is a nosode of tuberculosis, named and first described by Dr. Burnett. So Burnett was a very good homeopath, for whom it was prepared from tuberculosis sputum by Dr. Heath. So another one. As this preparation has been experimented with separately, its symptoms are given apart from the other nosodes of tuberculosis. So there's other ones, which I was mentioning. Dr. Cartier has found it particularly useful in cases where there are excessive purulent bronchial secretions threatening to occlude the lungs or to block the lungs. So they're not bringing up the mucus. They're filling up with mucus and in the bronchioles, and this would be an indication of it. It must be compared with Bacilinum testium, which is from the testicle, tuber bovinum, which is tuberculosis in a cattle, basically bovine, tuber aviaire, that's a French word for birds, and tuber cock, Koch. That's another doctor that tuberculosis. And what he did was he isolated the actual bacteria that's affecting the testicles, the cow, the birds, the humans. He separated it. Well, I can't think of the word now. He isolated it there. He isolated that bacteria, and brain goes numb every once in a while. He isolated that bacteria and presented it, and that's where that bacteria actually got named after him. Dr. Burnett has shown that ringworm of the scalp and pityriasis, versicolor, pityriasis versicolor on the body, and indications of tubercular diathesis. So what's that all mean? That means that someone with ringworm and this pityriasis is like a rash, and it's a big rash with little bits around it, so if someone has that skin rash and the ringworm, you basically would consider they have the tubercular disease. So why is that? I don't know why the ringworm is, but that skin thing, you know, the body, like I said, is always trying to push something out. So when you see a skin irritation, a skin thing, that's the vital force saying, oh, there's something bad going on in here. We got to get rid of this because it's going to kill us. And, you know, you can usually figure that they have the tubercular diathesis, which is the disease. And they respond to this remedy. So they have a skin rash, whether chest, belly, wherever it is. It's a big blotch with little blotches around, or they have ringworm spots on them. They would respond to the Bacilinum, which is the tubercular nosode. He cured a case of insanity with ringworm. So, you know, this diseases that are being pushed out into the skin, if you take care of it by putting something on it and pushing it back in, you will have insanity. So that might be what happened here. And this person was going insane, but it was still trying to push that out. And each time you took a drug or put something on it, it would push it back in, and it affected the brain. And, you know, this also will affect, you know, meningitis, hydrocephalus, you know, a lot of swelling and fluid retention in the brain. Tuberculosis patients are better in dry, sunny climates, in mountain areas, and in pine forests. That's interesting. Sunlight helps to prevent tuberculosis, so sunbathing they encourage. Also, there has been many cures of tuberculosis via sunbathing and the milk diet, which patients crave. So these patients crave milk. It's probably a very big indication of someone with tuberculosis. They crave milk, and then if they sunbathe, it sort of helps. It helps the condition. Tubercular constitutions for cases stemming from a tubercular inheritance. So this is under the constitutional stuff. So your relatives had tuberculosis. Now that miasm set up in them, and it can be genetically passed to you. So now you have the tubercular constitution from inheriting it from now what's the constitution? Extreme soreness of affected parts, patient of rheumatic tendencies, so a lot of joint pains, syphilitic taints, which is going insane, and what other thing is there? Going insane, meningitis, all that kind of stuff. Let's see, where am I? In the bloodstream. General muscular soreness. So soreness, joint pains, of course, lung stuff, lung situations, and then the syphilitic taint has to do with the brain and all that. Okay, so I'm not going to read that. So, Bacilinum tubercular nosode. Disposition to catch colds and sore throats. So anybody that's always catching colds, sore throats, this remedy is a great intercurrent too. You get someone that gets a cold and they have, what would you say? They get a cold and they have mucus and burning and all that kind of stuff, and you give an arsenic, and arsenicum's working, and it's working, and it's working, and then it stops working. So this Bacilinum can be an intercurrent, or if they have that tubercular miasm within them, the diathesis is the actual disease. They don't have to have the disease. They just catch a lot of colds and they have a lot of sore throats. That's a 3. And you would consider Bacilinum as a miasmatic remedy, basically. You know, and there's other ones, you know, like sulfur and calc carbs, and different ones can be considered to take care of some of these miasms. And a lot of times, you know, until you peel off the layers, and that's what my Robert Murphy, I'm listening to his tapes, a lot of great information, I'll tell you. When I listen to the tapes, he basically talks about, you know, you get someone always catching cold, so you got to get rid of the cold. They got joint pains. Next, you might have, you know, you get rid of the problem of them having colds all the time through a medicine. It doesn't have to be Bacilinum. Then you go to Russ Talks and you're getting rid of, you know, the joint pains. You know, all of a sudden, once this lung stuff goes away, now you got you know, them getting colds all the time. Now you get down to, you know, all of a sudden the joint pains start coming out. So that's another layer you've hit. So then you go Rustox or Ruta or some other, you know, medicines, Bryonia, to get through the joint pains. So once you get through the joint pains, then you know, you could get down to, you know, whatever's a grief, you deal with Adignatia and a bunch of different remedies, deal with the grief, Aurum Metallicum. Then you go down to the miasmatic situation, and that's, now you're down to constitutional. And that, you know, if you don't rip that root out, if you don't remove that miasm or deal with that miasm, all that work you did will come back. So now you're down to whatever miasm it is, you know, tubercular, syphilitic, you know, could be a combination. You deal with that miasm, you're ripping the root of that out. And once you rip the root of it out, now they have good health, and they're no longer, there's that cat, they're no longer they won't catch these colds again. If you don't rip that root out, then you basically will eventually this stuff may come back. You know, they may end up back in that same situation. Okay, chronic reoccurring sore throat and cough. Very little expectoration. So this even could have been good for ones in the having COVID, and they were, you know, they couldn't get up the mucus, their lungs were filling up, they had to go on ventilators, all that kind of stuff. You might have considered, Bacilinum would have been one of the remedies considered. But sore throats, and them sore throats go into the ears. Otitis after sore throat. So ear infections after the sore throat. Worse, night and early morning. So they wake up, you know, at night they start coughing, they can't go to sleep. Early morning, same thing, they're coughing. Worse, cold air. Let's see, taciturn. What the heck was taciturn again in the mind? Anyways, they're sulky, snappish, fretful, irritable, morose, depressed, melancholic, even to insanity. They're so down. They're so, you know, upset and depressed and all that stuff that it even drives them to insanity. Taciturn is, what is that? Taciturn, and this is probably, more of the same stuff. Reserved or communicative in speech, says little. Okay, so taciturn, they don't talk much. Loquacity is talking a lot. So if you were if you were doing homeopathic medicine and you've seen loquacity, that's talk a lot. Now I know taciturn probably won't. Oh, I had quiet up there. Sorry. I would have probably done it. But they're so melancholic, they're so down, they're so depressed that it even drives them nuts. Tendency to be frightened and fear of dogs. So there's a frightening situation in here. Just frightened about life, frightened about health, frightened about whatever. Pains in the abdomen, enlarged glands in the groin, hard swollen glands down in the abdomen. Sorry, spleen bulges. So the spleen actually, you can see it bulging out. Glands of neck enlarged. So a lot of glands are enlarged with this. Any glands enlargement you would consider Bacilinum. Enlarged and tender. So they can't even be touched. Sharp pain in left scapula. So the left back part of the, shoulder blade there. Worse lying, better warmth. So when they lie down, that left scapula gets worse, and if they put heat on it, it's better. Sharp pain in precordial region, arresting breathing. So that's the heart area. The heart area, they get this sharp pain, and they can't breathe. It stops their breath. Otitis after sore throat, like I was saying, they get a lot of sore throats and a lot of colds, and with a cough and nothing coming up, no mucus coming out, and they get this sore throat or this ear infection after the sore throat. Eczema of eyelids, so they'd have skin problems on the eyelids. Indolent pimple on the left cheek breaks out from time to time for weeks. That's a weird symptom. So they'll have every so often they'll have this pimple come out on the left side of the cheek, and it'll go away, and it'll do that for weeks. Female, it doesn't have nothing for whatever reason. Appetite is poor. They don't feel like eating. Severe headache, deep in, so it's deep down into the head, and this could be the hydrocephalus, the meningitis coming on, recurring time to time. So here's another periodic thing happening. Periodic pimple, periodic headache, worse shaking head, so they can't move their head. That could be a bryonia thing, but if they shake their head at all, it's worse. Pain feels like tight hoop of iron around it, so there's a great squeezing of the head. And that could be the meningitis, the brain swelling and that. Meningitis, good for that. Ringworm. Alopecia areata, which is the immune system attacking the hair follicles. So a lot of falling out of the hair because of the immune system attacking it. Nothing at the heart, which the heart we did say they get, where was that? Appetite, poor, severe headache, glands, neck. Pain, precardial region in the chest, sorry. And it arrests the breathing. That would be part of the heart stuff. A lot of things, I had to move some things around because it was like in the abdomen was something for the lungs. Where was that? Something for the lungs was up in there. Tabes mesenterica was up in the abdomen. So this is his first edition. I really need to get his 6th edition of the Materia Medica, because there's a few things in here that, can be done differently, just like this tabes mesenterica being up in abdomen, it shouldn't have been there, but it works. I tell you what, I use this book all the time, and it's very useful. Some things I have to sit down and say, oh, what's that, but he did do 3 more versions, so he perfected it more and more each time. So I can't wait to get this 4th. I wouldn't mind getting all of them and see how they progressed. One day I will. Let's see. Kidney, so no heart. Increased quantity of urine, pale white sediment. Rises several times a night to urinate. So they have, a lot of, they need to urinate a lot. And it's pale. That's because they're urinating so much with a white sediment. Yesterday's was, what was yesterday's? Azarac indica. I think that was a purple sediment was in there, and some of them are a red sediment. So there's, that sediment in the urine could be determined between a few different medicines. Limbs, trembling of hands. Hands are blue. Pain in left knee while walking. Tubercular inflammation of knees. So this hand's being blue, there's not a lot of circulation going on, and that trembling of the hands, they hold their hand up and it just shakes a little like that, where it should be like that. Anyways, left knee, pain in left knee while walking. So left knee rather than the right knee. That could help you determine between a couple remedies. Tubercular inflammation of the knee. So that's interesting that you have tubercular. It attacks the testicle, it attacks the knee, different areas it attacks on the body. No liver, lungs, weak lungs, and there's a big lung remedy. Humid asthma. Humid asthma just means, I guess during humidity they get the asthma going on. That's a 3. Catarrhal, colds and sore throat. So that's a definite, that's a 3. That should be a 3 down there too. Hacking, hard cough, shaking the patient. Does not waken them. It's more during sleep they have this cough, Let's see, catarrhal dyspnea. So in other words, they got a lot of mucus that is causing them not to be able to catch their breath. Mucopurulent, it's thick and sticky mucus. So that's why it's not coming up, and it causes them not to be able to feel like they can breathe. Expectoration of bronchitis. And that's why I say we don't care if it's bronchitis, if it's asthma, if it's COVID, if it's the flu, whatever it is. If we get all I need to know is the right symptoms. I gave my son, he does, been doing Klonopins forever, it seems, but he gave me a little piece of it, and I ground it up in a mortar and pestle, probably 100 times or more. I just kept grinding it. That gets it going. So then I took that out and I put it in just a couple grains in a bottle of water, pounded that 100 times. and that would be like a 1C basically, or yeah. Well, it was a lot of water, so it'd be more like an LM almost. LMs have more water in it. If you're doing a C, it's like 10 grains, but I just put it in there, just like yesterday, and then I ponded it, and he sipped it and ponded it and sipped it, and he said, yeah, it was working. With his mental situation. And lady was on a cruise, and she didn't have tobacco. Tobacco's great for seasickness. She didn't have it, so she took someone's cigarette and crushed it up and put it in water. Then she took, ponded that, and then threw that water out and left a drop in her, and filled it up with water again, ponded again. Did it like 4 or 5 times. That made it like a 4C or 5C or whatever. Gave it to the people, and the seasickness went away. So you can make a medicine anywhere. It's very interesting how this stuff works. So I did that for my son. Now, he said it worked, and basically, that's how the medicines are made. This one here from the sputum, it can be whatever disease it is. If the symptoms match the symptoms that this medicine's good for, which we got from approving, they gave this medicine until people got sick and they proved it. Unlike, the regular medicine, they give the medicine to see what kind of side effects and if it'll help with the situation, to suppress the situation. We're not suppressing. Whatever a substance will do to a person, it will also heal that in a person, no matter what the cold is, a COVID, a flu, a bronchitis. Doesn't matter. If they have humid asthma, catarrh, the mucus isn't coming up, it's thick, they're coughing like crazy, you would consider Bacilinum, no matter what the disease is. No male. Now, under male, it should be tubercular. No, that would be the other medicine. Tenesmus, which is, or testicle, whatever. Mouth, strawberry. Congestion of lungs is still there. Tuberculosis it's good for. Bubbling rails and mucopurulent expectoration is a 3. So a lot of bubbling mucus going on. And that's, they're not pulling any mucus up. So that's a big one. The strawberry tongue. Now, that tongue, I got that spelled wrong. Well, that tongue, a strawberry tongue, that's also belladonna, I think, has a strawberry tongue. So, that's a great indication, but, there's a couple medicines that could have that. Let's see, sudden diarrhea. No nose, sudden diarrhea before breakfast. So they get up and then they have all of a sudden have diarrhea before they go to eat with nausea. So that's probably why they have a poor appetite. Obstinate constipation with offensive flatus. So their farts stink and they can't go to the bathroom, or they have this diarrhea. Severe hemorrhages from the bowels, and there's stitching pain through hemorrhoids. So they got hemorrhoids probably from pushing a lot, can be from other things, but a lot of stitching pain from them, and then severe bleeding from the bowels. Ringworm, pityriasis, eczema, glands enlarged and tender. So all this skin stuff points to the fact that the bacilinum, the body's trying to push that disease out, and trying to get that out of the body. Absolute sleeplessness, talks in sleep, drowsy by day, many dreams, and restless at night. Windy dyspepsia. So that's burping. They got like a heartburn thing going on. With pinching pains under ribs, right side in breast line. So the right side under the pectoral area, they've got pinching pains. And they've got this burping, all this burping. Pyorrhea, the teeth rotten. Mercury, I think of those kind of things. Silica, a few other ones. Aching, lower incisors. So there's just a total aching pain, even if there is no decay of the teeth. But they grind their teeth in the sleep too. So these people grind their teeth. Bacilinum. Anybody that's grinding their teeth, you would consider that. Flush of heat, perspiration, lots of perspiration, flush of heat, fever with emaciation, night sweats. So that's another reason why they're probably not sleeping. Night sweat between the cough and the sweating and that kind of stuff. tickling in fauces in the throat, basically compelling them to cough. So that's where the cough is coming from. Some coughs will come from the lungs. Some cough will come from the pharynx, the throat, the fauces. So they have a pricking in the larynx also with sudden cough. So the fauces is tickling, the larynx is prickling. So, all right, let's, there's some good stuff in the back. I may hopefully have time for all this. In the provings, Bacilinum produced, let's do this. Yeah, get tired of trying to look up over there. Okay, in the provings, Bacilinum produced a severe headache deep in, worse by motion. Now that's a Bryonia symptom, was a constant symptom. So worse by motion was a constant symptom. Also a slight cough with easy expectoration of phlegm in cases of acute bronchitis. So just all of a sudden it come on. Later on it will start building up in the lungs. It has not done so well as in more chronic cases. So this one wouldn't be so much chronic tuberculosis, but if you catch it right away. Also, they are leading indications for it when present in combination with other disorders. A case of insanity with pityriasis. Pityriasis, yeah, that's what it sounds like, yielded rapidly to this remedy. So, that's the miasm. Definitely, they have this skin thing going on, and causing them to have insanity. Pityriasis has been cured by it when all attempts to kill the body lice by chemicals were useless. So they're trying to kill body lice, and and this is ringworm, body lice. But they have this skin problem when they're trying to kill that with chemicals, and it's not working. Bacilinum you want to consider. Dr. Young was a good homeopath, has recorded the cure of several cases of cretinism. Cretinism is your thyroid's not working, not producing the thyroid, what is it, insulin, I think is what it is, yeah. It's not producing that, so that's what cretinism is. He cured several cases of that. Might be something to consider. I don't have bad, they were putting me on, I went to a, what is it, something life, and they were treating me for, they were just giving me vitamins. I was basically taking vitamins, and like magnesium and vitamin D, which we all need, they know. So I'm paying them to tell me what I need. They did blood work, and that would tell them what I'm low on and all that, which is very good. You should do that. You can do it with your hair too, find out what minerals you're short on. But when I found that out, they started giving me a thyroid pill, and I got real thin, and I didn't feel that great. I was real thin. But realizing that I had thyroid stuff, that means I would have had to been on thyroid pills forever, and I wasn't doing that. So I discontinued that, and I'd started some thyroidinum and some different things. An intercurrent course of Bacilinum will often make a wonderful change in patients who have a personal or family history of chest disorders. So anybody having lung disorders, and I may do this because I've had lung disorders since I was young. Could be tuberculinum miasm from my family, somewhere in the past. Clark has found, another homeopath, eczemaceous conditions, that's eczema, of the margins of the eyelids, a strong indication for it. So their eyes have this skin infection. It is a miasmatic remedy of vast importance. Grimmer uses for cases stemming from a tubercular inheritance. So that's what I'm saying. It comes from your genes. My parents, my grandparents, my great-grandparents could have had tuberculosis at a time. Took care of it with drugs and that, and now I got the miasm. With extreme soreness of affected parts, patient of rheumatic, and I do have joints, well, I did have joint stuff. My joints aren't too bad now. Tendencies with syphilitic taints in the bloodstream, general muscular soreness. Okay, phosphorus, droserium, mercury, these are all remedies that would be considered. When you start looking it up, you'll see these remedies in there when you are looking up certain things. It affects its effects seem to be identical to that of Koch's tuberculinum. So he isolated that bacteria and he made a medicine, and they're pretty much the same. Both are useful in the tubercular diathesis when you have the disease before tuberculosis has developed. That's diathesis is you have the taint, you have the miasm in there. In the early stages of tubercular disease of glands, joints, skin, and bones. So that's what tuberculosis can affect, and this is very effective in all them. Serinum is another one, Bacilinum testium, antimonium tart. Now, antimonium tart, you can get, that I used that during COVID because so the mucus didn't all build up in my lungs. Iodine is another one, and iodine is good for the what is that gland up there? The anyways, lachesis, arsi, myostosis. What did I just say? I just said the for your oh man, sorry about that. Levico 5 drops. There's another one. Levico is mineral water, arsenic mineral water, follows as an intercurrent where much debility is present. So that's another part of this. Kali carb, Kali phos goes with this remedy very well. Also lachesis. So there's comparisons of remedies that you would see if you're looking up these symptoms here, and a lot of these medicines might be in there. The thyroid, that's what I kept trying to think of. Iodide is great for the thyroid. Now, when there's nuclear stuff, they say take iodine for the thyroid to protect it. But iodide is a great medicine homeopathically for the thyroid if you're having problems with it. And that's what I started. I did some iodine and I did some thyroidinum, and I may do some more again. So, all right, that is morning medicine. That's Bacilinum, the tubercular nosode. Now I'm getting into Bacilinum testium, which is the tubercular disease in the testicles. So, and they took and did a medicine from that. So, all right, that is morning medicine. You can age, but you don't have to get old.